This is the sterilizable packing box for MUA scan kit. Here are the steps to place our MUA scan body. 12 pieces scan body with different identifying point. There are gingival height 3 mm and 7 mm of the scan bodies which have the same identifying point. These are the 8 pieces MUA healing cap. Here are the 8 reserve scan body to be used on temporary denture. This part is the 10, 15, 20 MUA pin with different shape. This is the final screwdriver. To make sure get accurate digital impression, we should choose the different scan bodies and connect pins. When choose the different gingival height scan body, we should make sure all the identifying point are fully exposed above the gingiva, and the bottom of the scan body should not compress the gingiva. The length of the connect pin should be less than 6 mm from the body of the neighboring scan body, which can be longer but not too short. Now place connect pin into scan body outside the mouth. Our scan body and screw are integrally molded, which will not cause the risk of screws falling off. But before installation, make sure the screws are in a loose state, to avoid incomplete disassembly during the last use, so that it is convenient to install in the mouth. When installing, we should hand hold connect pin. Make sure that the connect pin is in correct direction, and install the posterior teeth first before the anterior teeth to avoid the patient's fatigue of opening the mouth. Now we finish the placement of MUA scan body and connect pin. We should remember that the correct placement will help you get the accurate impression.